Many individuals experience an ankle mechanical functional instability. However, in order to decide if this is a problem, we're going to have to rule out some other injuries that could occur that may produce some of the same signs and symptoms. One of the first is the subtalar joint sprain, and this is assessed using a subtalar joint glide. This joint glide will isolate pain to that sinus tarsi instead of maybe radiating throughout the entire joint. A second injury to rule out is a foot sprain. Foot sprains can occur by the exact same inversion and eversion mechanism of ankle sprains. If the person has an inversion mechanism, we're really going to focus on the lateral mid and forefoot for that sprain, whereas if it's an eversion mechanism, we're going to look at the medial mid and forefoot. Many sprained ankles are not really sprained ankles, they're perineal strains, and so that should be ruled out, as well as remember to take a look for a dancer's fracture at that lateral tubercle there. And then we also want to rule out Achilles tendon ruptures. When we talk about functional instability, then really people are going to describe it as the sensation of the ankle giving way under a load. There are three different things that we can kind of think about this occurring as. You can have a mechanical instability or a plastic deformation without functional instability. You can have mechanical instability with functional instability, or you can just have a functional instability without mechanical instability. And if you look at this chart, you can see how mechanical insufficiencies can be one area that we really look at, pathological laxity versus degenerative changes or synovial changes, whereas your functional insufficiencies or instabilities are going to be things like strength deficits or impaired proprioception. Well, if you get a combination of those things, this is going to increase that risk for the recurrent ankle sprains. Those things that are going to contribute are things like anatomical factors. So you may have ligaments that lack stability due to plastic deformation of the ligament or joint capsule. You may also see this in individuals that have forefoot or rear foot alignment issues, but specifically forefoot valgus. There's also biomechanical factors such as decreased dorsiflexion. Additionally, you may have issues with the sensory motor control system, which, remember, that is really the system that controls dynamic joint stability. Typically not a problem is perineal muscle atrophy, although it can occur if someone has damaged that perineal nerve. You're more likely to see decreased joint mechanoreceptor function, which leads to a decrease in proprioception and or kinesthesia. Again, you may have part of these, you may have several of these, but the more that you have, the more that they're going to come together, and you'll end up with this chronic ankle stability that leads to recurrent ankle sprains.